All right, Kim Kardashian's brain aneurysm. Let's talk about it. First of all, what's a brain aneurysm is a dilation in an intracranial artery wall. Usually it's focal, which means it happens in one area. It's due to a weakness in that artery wall. It's usually at the branch point of blood vessel. There's different types of aneurysms, and for the sake of this video, I'm not going to go too much into it. Just know that the most common is saccular, which we call berry aneurysms, which looks like a little outpouching of the blood vessel. You have fusiform aneurysms, which is like a circumferential dilatation, which means the whole blood vessel looks swollen. And then you have the dissecting aneurysm, where there's an actual tear and blood fills it up. About 2 to 5% of adults have aneurysms. The rupture risk is about 1% a year, but that really depends on a lot of things. It depends on the size of an aneurysm. For instance, if your aneurysm is less than 5 millimeters, it's very unlikely to rupture. It's what we call benign. Usually these don't cause symptoms and they're found incidental. But of course, if you're having symptoms like headaches, if you're having eye pain, for example, you have hypertension, or you have other risk factors such as smoking, alcohol use, being on cocaine, or using oral contraceptives, all of those are risk factors. So I think anyone who has those risk factors is having new neurological symptoms should get a brain MRI and should also get the vessels looked at. There are other risk factors such as family history, Ehlers-Danlos syndrome, Marfan's syndrome. Those are all collagen vascular or a condition that affects the actual collagen that makes the blood vessel. Now, when these rupture, they present as the worst headache of your life. When someone presents with the worst headache of their life, that is something that you take very, very seriously and you evaluate them for an aneurysmal rupture. Diagnosis is with a CT angiogram to look at the blood vessels. You can do a spinal tap if you're worried that they're bleeding. But more likely than not, the management is to control any modifiable risk factors, such as stopping the smoke, controlling blood pressure. If it's less than 7 millimeters or even less than 5 millimeters, I just do serial screenings, which means you check every 6 to 12 months to make sure that they're not getting bigger. If they are symptomatic or if they're larger than 7 millimeters, some neurosurgeons will intervene, and it's our job as neurologists to refer you over there. This is more for the neurosurgeons, but there are different ways to treat an aneurysm. You can clip it, you can coil it, you can put in a diverter, which is essentially a stent that takes blood away from the aneurysm. In any case, her aneurysm, there's been no details revealed. It seems it might have been asymptomatic. I'm not quite sure, but it is less than 5 millimeters. So in this case, they will most likely just do some screening, watch it over time to make sure it does not grow.